So good morning, dear friends, ladies and gentlemen, distinguished guests. I welcome you to this special event hosted by the United Nations Institute for Training and Research, the UNITAR, and in collaboration with Takeda. And we are here to shine a spotlight on the question of the life-saving effects and the life-saving potential of the plasma-derived medicinal products, which can really make a huge difference in the lives of many people around the world. And we are here to discuss this critical need and how to improve the access to these therapies. Because as you know, these therapies are really essential and can be critical in treating rare and life-threatening conditions. And yet, many people still lack access to this treatment around the world. So let's have a quick look into the agenda of today's discussion. We will start with opening remarks by Mr. Alex Mejia and Mr. Giles Platford, and right after we will dive into the panel discussion with experts and representatives from various fields who can bring their own perspectives to the table. And make sure that you stay until the very end of the panel discussion, because that's when the reward comes. We will have an informal time and reception over the breakfast, very tasty breakfast, which is prepared for you. So, but before we begin, I would like to express my gratitude to all of you who came today, this morning, to this event, because that shows really a commitment, particularly, to wake up that early and come. That shows really something, that you really are close to the topic. So thank you once again. And so let's start. To set the stage for our discussion, I now call upon our two distinguished speakers to open the discussion. First, we will hear from Mr. Alex Mejia, Director of the Division for People and Social Inclusion at UNITAR. In his current capacity, Mr. Mejia serves also as the director of UNITAR's global CIPOL network of more than 30 training centers around the world. His career spans 2 decades in private and public sectors, including corporate banking, as well as diplomatic service for his own country, Ecuador. In 2001, Alex became the Vice Minister of Economy, representing his country to the International Monetary Fund, the World Bank, and the Inter-American Development Bank. So Alex, we are glad to have you here with us today, and I invite you to open the discussion.
Every time that I come to an event and I do read the briefing and so on, I actually think why this is important. And I really want to tell you in the most sincere of manners that when you talk about access to plasma and PDMPs, plasma-derived therapies, I'm talking with the experts here. But when I learned that, long time ago actually, I understood that it has to be at the top of the priorities of any government, any health sector, or any group of patients or associated with patients and the like. So, of all the events that we have been having on Monday and Tuesday, non-stop, and I guess for most of you or all of you, this is very important for us. This is the type of initiative that actually save lives, literally, and it's something that happens only because of partnerships. So our time in this very nice breakfast is very well used today and invested. Now, this also wouldn't be possible without the support of Takeda. I have to say it very publicly at the United Nations. You understand, we are always well sanitized and kosher, as they say, in the things that we mentioned. We are intergovernmental organization, of course, from the public sector, and we do all the due diligences that you can imagine when we select a partner. I'm very happy to say that when we did that with Takeda, Takeda is quite an impressive corporation that we have come to respect, that actually does a difference globally, and particularly in this setting, we will have is having already a humongous impact in very many people's lives. Thank you for being here. So, with that, I wanted to tell you that I have to deliver these things for the video. Bear with me, please. That at UNITAR, our vision for partnering on initiatives like this one is to work together to achieve the shared goals defined in Agenda 2030. You do remember that in September 2015, the world, 193 member states of the UN came together with the Agenda 2030 for Sustainable Development and its Sustainable Development Goals. And we are very happy to try and put together anything that we do under that umbrella and that vision. But we are not so happy because of what I'm going to say now. Many of you perhaps know, but it serves as a reminder for the people that will be watching us in the days and weeks and months to come. Everyone at the UN, if I may, is asking any agent of change, any person willing to listen, that we need to accelerate our efforts to achieve Agenda 2030, particularly when it comes to SDG 3, Sustainable Development 3, focus on health, of course. Because it's very sad to tell you today that this virtuous cycle that started in January 2016 and that is to be completed by December 2030 was advancing as planned and beyond in 2016, 17, 18, and 19, and then something called COVID came. The pandemic halted our efforts and then almost stopped them completely, and the recovery since 2021, late 21, 22, 23 today, unfortunately is very dismal. We are not, in most of the Sustainable Development Goals, we are not where we were in 2019. Our Secretary General, I report to Mr. Guterres, Antonio Guterres, and my Assistant Secretary General, who's known as one of the fathers of the SDGs, Assistant Secretary General Nikhil said, they keep repeating the same thing for the last year. 15% is not acceptable. And when they say 15%, what they mean is that only 15% of the 17 SDGs will be achieved by the year 2030 if we continue as we are. And when you go to health and public health systems, I don't want to give you the percentage because it varies, but in the developing world it's even worse. So, going back to my remarks, because again, we ask you to help us in accelerating. Again, we needed to focus, we have a strategy of focusing when it comes to public health on niches that are priority niches for us. Dr. Tedros at the WHO is a great friend of the house and someone that I admire, and he has been trying hard, as you know, to push for a global treaty on pandemics and pandemic control and so on. And also, I don't want to come out as pessimistic, I'm an optimist by nature, but we have to say it as it is. We need your help also, because I believe through this information, this global treaty is under threat. I saw yesterday, you wouldn't believe it, but I saw yesterday in this avenue, we are on the outside of the Palais de Nations, a beautiful restaurant called Bierwa, in front of the headquarters of the Red Cross. This avenue, the Avenue de la Paix, the Avenue for Peace, had a humongous bus in light blue, the UN color, saying oppose the treaty, right? So we need help. We need help in sharing the right information, in motivating people to recommit to what we need to do and to deliver on this global commitment to improve health everywhere, particularly in developing nations. So at the same time, let me go back to the point that we understand the need for PDMPs. We also see that many patients around the world still face significant barriers to accessing these type of therapies, life-saving therapies. For these patients, access to adequate treatment is often a question of life or death. This is why our collective efforts are so vital, by fostering collaboration among governments, patient organizations, thank you again for being here. The private sector, thank you for your support, Takeda Corporation. And other key stakeholders, we can work towards overcoming these barriers and improving the situation globally, building a more equitable healthcare system that serves all patients. As we are about to begin this event, I would like to highlight that this initiative is the result of 2 years of collaboration among many individuals and organizations. Particularly, I would like to appreciate our partnership with Takeda and with your team. You have an impeccable group of professionals that are actually committed to the task. our admiration to them. And if I may add, I would like to also tell you that we need everyone else's expertise and commitment to bring to fruition what we have thought that we should do. Finally, our mandate at UNITAR since 1963, where we were created by the General Assembly, is to build capacity. You don't build capacity with a conference here, a roundtable there, or a little seminar the next day. You build capacity through a process, a pedagogical approach to learn that actually offers someone the ability to keep back at it and back again. So it's a journey. It's not one event. We are not in the business of conference or seminars. We're in the business of capacity building. To do so, the creation of a platform, a global hub for training, a training platform on the internet is critical for us. And I'm very happy to tell you, to conclude, that UNITAR and Takeda are very much committed to this platform to teach on how to do this. So with that, thank you again for being here, and I hope that this is a very successful event. Thank you, John.
Thank you, Alex. Thank you for your inspiring words, and particularly emphasizing the importance of why we are here and the importance of joining forces, joint efforts on something sensible to be achieved. Next, it's my pleasure to introduce Mr. Giles Platford, Takeda's president of Plasma-derived Therapies business unit, who will also share his opening remarks. Mr. Platford joined Takeda in 2009, since when he assumed many leading roles in different parts of the world, including Brazil, Middle East, Africa, as well as Europe and Canada. Mr. Platford is also the current global chair of the board for the Plasma Protein Therapeutics Association, the PPTA, which represents the private sector manufacturers of plasma protein therapies. So, Giles, the floor is yours.
Thank you very much for the introduction, Mr. Mejia. Thank you so much for the very kind words, also for your very inspiring and passionate opening remarks. We can really feel your care for the subject matter, and we appreciate your leadership at UNITAR and the collaboration we have with UNITAR. And thank you for bringing together your knowledge partners today for this roundtable breakfast meeting. It'll give us the opportunity to emphasize the importance of plasma and plasma-derived therapies, as you so perfectly did at the start, particularly for improving health equity in developing health systems, but also for us to share some of the highlights and put a spotlight on some of the initiatives that come out of our collaboration and the Plasma4Life platform, the training platform that you spoke to. Thank you also to participants and the people that have shown up today. We appreciate you taking time as esteemed country delegates and representatives of the global healthcare community to join us to discuss this important topic, particularly during a very busy World Health Assembly week here in Geneva. On a personal note, and you did mention it, Jan, I have spent of my more than 20 years in the pharma industry, more than half of that actually has been in emerging countries and health systems in Southeast Asia and Middle East Africa and in Latin America. So this is a topic that's very personal to me in ensuring health equity for all patients worldwide, regardless of which country or which part of the country they may sit in. Every patient deserves to have equitable access to life-saving and life-transforming treatments. And that's what we're here discussing today. And as Takeda, we're a leader in the biopharma industry, and in this case, a leader in the plasma-derived therapies industry, and we care deeply about the topic of health equity, and we have health system strengthening programs in more than 80 countries worldwide in various different therapy areas in which we invest in research and development. And we're very proud to be partners with UNITAR under this umbrella of the Plasma4Life platform, together with patient groups and other stakeholders, to ensure equitable access to plasma-derived therapies, particularly in emerging economies. And I'm excited to be able to talk about some of the wins we've had already in Malaysia and Argentina thus far. The uniqueness of plasma-derived therapies versus other traditional biopharma sectors is that plasma can only be sourced from healthy human donors, and there's never enough of them, and there are only a handful of countries today where policies actively encourage and enable public and private sector collaboration to put in place the infrastructure needed to source sustainably plasma, which means ultimately we're far too dependent on far too few countries for sustainable supply of plasma globally, and ultimately that means that particularly patients who are much in need of these life-saving and life-transforming treatments and often don't have alternatives, who are in emerging health systems, often do not have equitable access. And the demand for these treatments continues to grow and outstrips our ability to invest as an industry, also in the public sector, in capacity expansion. So we need to see more countries doing their part to contribute to global supply, but also particularly working in partnership with relevant stakeholders to strengthen the plasma ecosystem in developing health systems so that those countries can achieve at least some level of self-sufficiency and the ability to fund sustainably access to these treatments. So I think that was where this public-private sector collaboration was born, out of the necessity to address this very critical concern. I'm proud of the progress that we've made thus far. I think we've got the Knowledge Hub up and running. This Knowledge Hub is now accessible to other countries outside of Malaysia and Argentina who would want to leverage the learnings from what's been done there. I'm looking forward today to having a discussion around building education and awareness on the subject of plasma and plasma-derived therapies, celebrating some of the successes that we've had thus far, also perhaps learning from other countries what their needs might be and how we can better support them. So thank you once again for your participation. I look forward to a good discussion.
Thank you, Giles, and thank you both for setting up the stage for this discussion. We have heard improved equitable access, strengthening health systems, partnerships. So all of these things, now we can dive deeper. What does it really mean in practical terms? And what are we actually doing to achieve that? So I think we can move on immediately to the panel discussion. And we are privileged here to have among us an esteemed panel of experts, and those experts who bring really a wealth of knowledge and experience, professional but also personal, I have to say, to this table. So I would like to turn first to our distinguished representatives and panelists from Argentina and Malaysia, because these two countries have shown remarkable leadership. Remarkable leadership in this field, also because of joining this initiative, which we have started at UNITAR, and setting an example which we hope will be followed by other countries. So we are honored to have here with us Mrs. Roberta Anido. Roberta is the president of the Argentinian Association for Assistance to Patients with Primary Immunodeficiency. And Roberta is also the co-chair and a dedicated member of our expert working group in Argentina. So Roberta, the first question goes for you. What are the most significant barriers to equitable access that patients face in accessing PDMPs in Argentina, and how can they be addressed?
Well, first of all, I want to express the importance of this kind of meeting to demonstrate the unique nature and value of plasma-derived medicinal products in order to improve patient access. I am really very honored to be here because most of things I have different hats, but I am the mother of a patient with primary immunodeficiency. So for me, plasma that everybody has available to have the medication, I think is the most important thing. Well, we in Argentina, as you know, although we have health is a constitutional right, being a federal country with 24 provinces that are really autonomous, this makes access more complex because each province has to advocate for national diseases or national law. Primary immunodeficiency in Argentina are considered rare diseases, so we have a law of rare diseases, but despite this, in most cases, it's not, they didn't accept or didn't consider this law in most cases because on purpose because they want to delay to give the medication, and on the other hand, is a kind of playing that they want to know how much the patients know their rights. So this is really tricky, and we also have a lot of administrative bureaucracy, a lot of paperwork in the private and the public sector, and this is something that it is difficult for the patient to read and to have the treatment. The Argentine law established a full coverage of these medicines, but despite this, the patient needs to litigate in order that the law is complied with. On the other hand, that is why the patient organization, our patient organizations, provide free advice and support through a legal team, so that the patient can access to the treatment. And this is a tool that, a benefit that the patient has to come in our association, because to have a litigate is really very expensive, and not too many people have the money to pay. So I think this is an important tool we have. On the other hand, we train the families to navigate the health system, because it's really very complicated in Argentina. And also we training them about their rights in order to have the access to demand for their treatment, because in most cases they have the delay, they don't have the treatment in a timely manner. And on the other hand, they also they suffer from shortage doses, and also they change a lot. It depends of the private or public sector what they buy. They usually change without asking the patient or the doctor if this is possible. On the other hand, we know that in primary immunodeficiency, immunoglobulins are really very essential, because we don't have another treatment available for replacement. So that is something that we train the people to know that they have to fight for that, and also. For us, it's very important that immunoglobulins are on the list of the essential list of the World Health Organization, and this is a very important tool that also, as a national group, we use it. We don't have to work alone. It's really very important to work with other patient organizations that need this kind of plasma-derived medicinal products. We are sharing different ideas, working groups, and also it's very important to be members of international organizations, umbrella like Hypopi, also RDI in different groups, and also we work a lot with the National Federation of Rare Diseases in Argentina, FADEPOF. This is really very important because we are stronger. They open many doors that maybe in national small organizations it is impossible. And another thing that I think that we need to work very much closer with all the stakeholders. It's important that we can reach the government, we can reach the private sector, the public sector, the academia. We need to, I think that the voice of the patient must to be heard. Our needs, it's important that they understand what we really need, because sometimes we don't need too much things, and maybe the other stakeholder needs that we need more. I think that it's important to work in the same table, and so I celebrate this meeting for that. So, well, I think that, and the other thing that I think is very important is also that we need to work with education and awareness, because it's important not only for our community, for the general population, also with other stakeholders, because it's important that they know that plasma and blood donation is really very important for us because we need life-saving treatments. Thank you. Sorry for my English. I would like to speak in Spanish.
It's perfect.
I'm so sorry.
And thank you very much, really, for sharing these national perspectives, because we need really to hear from the ground what really is the troubling people. And we see that the challenges might be different. There is no silver bullet solution which could be applied across all the countries. So that's why we need to hear, and that's very useful. So now, joining us next is Professor Dr. Adviabi, who is the head of immunology services at the first and only children's hospital in Malaysia, if I'm correctly informed. Yes, and also a key member of the expert working group, which is connected to this initiative. So, similar question for you, Dr. Advi. What are the unique challenges you face in Malaysia regarding access to PDMPs, and how is this working group addressing these challenges?
Thank you so much, Luan, for the kind introductions. And I would have to say that my work as a second speaker after Roberta is very good, because we actually have summarized all the challenges that we have among our patients as well as clinicians. But I'm going to also just add on a few key points, 3 points that I'd like to focus on the unique challenges that we have in Malaysia. The first one, especially with Mr. Alex Media actually highlighted about ensuring sustainable access of this very important and life-saving medication. Malaysia, although that we don't really have a national fractionation plant, we do have our own immunoglobulin products. And how is this being made of, or kind of like have access to it, is through this government-private partnership. So we do have blood donation centers, and chunk of these immunoglobulin products, our own levels, our own Malaysian kind of immunoglobulin products, through this recovered plasma. It is a very precious commodity. Unfortunately, as we know, because it is not regulated in the form that the quality of this plasma, a lot of this precious commodity go to waste. Means that the value of this precious plasma that supposed to be available to sustain the need of this plasma product are not to the quality to come up with the products that we intended to be. So one of the things that UNITAR had been working together with the Malaysian government and us is to ensure that this precious commodity in the form of recovered plasma will be at this quality that we want for us to enable a better and sustainable access of this immunoglobulin, not just for Malaysia, possibly if there is an access to it to be accommodating for the needs of the region. So that's one. Another thing is that we are highly dependent on the national blood centers who actually have this access of this commodity through the blood donation. And plasma collection is another way that we actually can do that, but this is not highly regulated and being done in Malaysia, and it should be done because there's another way that we actually can have access and to ensure the sustainability of these products, these PDMPs, for the region, for the countries as well as the region, and of course for the Asian population, because I think we kind of knows that most of the immunoglobulin products that we are using right now, or the PDMPs, are very much based on the supply, not from the Asia Pacific region. That's one thing. The second thing is about equality, and we actually mentioned this, we actually mentioned that as well. Yes, the good thing about Malaysia and the work that we have done, IPOP have done when it comes to ensuring that immunoglobulin is part of the WHO extension list. That's good, and we have that. Malaysia do have an access and it's subsidized. However, it needs to be within the indication that it is there. And primary immunodeficiencies are one of the indications, but you know that a lot of PIDs are being discovered over the last decades. And these indications need to be updated. And unfortunately, if they are not in the list, they will not be covered and have the equal access to it. So I think that's one thing that we need to highlight about making sure that indication is updated. Another thing about equality is that as the rare disease as we are basically being considered, they thought that it is only among pediatrics. The access to adult patients are not automatically being covered, although that the disease stay with them. Because it's a rare disease, a genetic disease, they're going to have it throughout their life. Why does adult patients with this do not have the equal access to children? Of course, I'm a pediatrician. I have the opportunity to make sure my patients have it, but after they grow up, and now we have a lot more patients survive because of the treatment we're given, the adults, when they just turn 18, they do not have the equal access. That's about what you call equality. Then the third thing I like to highlight is about equity. Yes, we have access in terms of the government sectors, but Malaysia, as a lot of developed countries or developing countries, we have the urban part and the suburban part. And most of our patients due to genetic disease, they were located not in the urban areas. And having access to immunoglobulin in the form of intravenous required them to travel to the main hospital. But in the case of immunoglobulin, we do have option of subcutaneous that make it less or make it more suitable for these people who stayed further away from the institution to have access. And it should be that, the alternative to have that, the equity of this patient to have options to have it near. Not just because you are from a different social context, you do not have the same equal rights to the medication. I think these are the three things that we highlighted. And I think from the UNITAR angle, we are working together in terms of coming up with a better programs, a better way of making sure our quality of plasma is good. And then of course, we are currently working out on how can the country actually sustain the immunoglobulin for the nation as well as the region. And we are also working in terms of making sure the indication will be comprehensive and equality and equity for everybody that should receive this product. Thank you.
Thank you very much. Now I would like to come to the most important voice in all of this discussion, and that is the voice of patients. Because these are the voices which are the most, these are the voices of the people who are the most influenced ones by the health conditions we're talking about, but also by the policies and decisions which govern the access to this treatment. So it is their experience and their needs which need to guide our discussions and our thinking in this field. So I'm very glad to welcome among us Mrs. Leila Solis, the Senior Manager for Health Policy and Advocacy at IPOPI, the International Patient Organization for Primary Immunodeficiency, the PID. And IPOPI plays a crucial role in advocating for the PID patients worldwide. Leila, a question for you. Can you describe the advocacy efforts IPOPI is undertaking on behalf of PID patients, and how do the partnerships, such as the one we're talking about today, for example, fit in?
Thank you. Thank you, Jan, for this very nice introduction, and thank you for the invitation to this very interesting roundtable. Just a few words, just to piggyback a bit on what Robert and Anthony have been saying. Not having access for a patient means that perhaps if you live outside the main capital, you need to travel to your hospital, and then you find out after several hours of traveling that you don't have the therapy, and that you need to go home without the therapy, with the burden of not knowing whether you will have it tomorrow or the day after, and that you know that you need it. Because basically, as Roberta said, the therapies are needed. They are needed in a recurrent manner in the case of primary immunodeficiency, and you need them for life. So you need to cope with those diseases in sometimes not so good settings, and then you need to cope with that, plus the burden of not knowing whether, or the uncertainty of not knowing whether you will have access to them. So on the basis of that, that's why IPOPI has been working hard in several levels to ensure that we have equity, or our patients have equity and sustained access. At national level, we have been empowering, educating, capacity building, providing capacity building to our national member organization, to the leadership of the organizations, and also the medical advisors that support the patient organizations. especially when they are new, when they are in developing countries, so that they are able to establish this dialogue with policymakers. Because it's not always easy to start a dialogue when you're a parent of a patient and you have to deal with your child's health issues. And you don't know how to start the conversation, or you don't believe that they will be keen on listening to you. So we need to train those patients so that they are aware and they know that their voice is essential to make sure that the health system is equitable and it's right, because they are in the end the ones that their health systems are created for. They are the ones in need. Also at international level, what we've been doing is partnering with institutions and international bodies, be it, for instance, at the European Union level with the European institutions, Council of Europe, beyond the EU, or in the area of Asia Pacific, for instance, through the Plasma Leaders Network, or the Asia Pacific Economic Cooperation, for instance, to ensure that we are talking in different forums with the same voice and the same message, to ensure that patients have access to the life-saving therapies. So, in the case of UNITAR, for instance, with whom we are very happy to collaborate, because I think it has been a pleasure to be sitting, or from the beginning, be sitting around the table at the same level with other participants, with other stakeholders that have different perspectives, but we are all discussing around the same table in a neutral and also constructive manner on how to make sure, or how to make of equity of access or sustained access to life-saving therapies like hemoglobins or PDMPs a reality. So that's something that we really appreciate, and we are thankful for that. Because, I mean, today, if I'm not wrong, the WHO Assembly was adopting the resolution on social participation. I think this is a clear example, a meaningful, the UNITAR, the Plasma4Life is a meaningful example on how this social participation, by inviting medical experts, patients, can be advancing on meaningful topics for us. And we think that it brings the knowledge sharing on how to improve the ecosystems. And the ecosystems may seem very theoretical, but in the end it means that patients will have access to the therapies they need. And that's something that we are really looking forward to continue the collaboration with.
Thank you very much. Next, we have Mr. Alan Baumann, the CEO of the World Federation of Hemophilia. Alan has been a leading advocate for hemophilia patients globally, and he has been striving to improve their access to essential treatments. Alan, what are the key priorities for your federation, and in focusing on, your federation is focusing on, and particularly in not just the currently, but in the coming years as well? Thank you.
Thank you. Sorry. Thank you, Jan, and thank you for the kind invitation this morning. Glad to be here. The Federation has not been very present in WHO events in the last year, so it's our first meeting actually this year, so we very much appreciate the platform as well. Obviously, you can say hemophilia is, we've been very unfortunate first. When you think of what happened 20, 25 years ago. I always tend to say 10, 15 years, but it's not 20, 30 years ago. But fortunate because it's been what our president always called the golden age for hemophilia. There have never been so many choices for patients, different therapeutic choices and treatments. But that's true in the developed world. We estimate that only about 70% of the patients are diagnosed, and roughly it's the same number who have no access to treatments in the world and no access to sustainable treatment in the world. So we can look, at capacity of recombinant, we can look at capacity of plasma. We would never be able, with what's existing today, able to cover the need of the patients if those patients will be diagnosed. So my first point is diagnosis. Those patients are not diagnosed, we don't even know and we have good representation of the countries, we don't really know what happens with them. We don't know what, do they die? Do they don't see a physician ever? So the fundamental infrastructure in the countries, I would say, in those developing countries, is what's missing the most. And we tend to forget this, that if we don't have this in place, nothing that can be done. So for us, diagnosis is really, and the number really, it's one of the big frustrations. It hasn't really changed. When you look at the numbers 10 years ago, 20 years ago, you would see roughly the same number. The population growth continues, and the diagnosis is not, the gap does not really narrow. So that I would say is key. And obviously the point that was given to us for years was, but if there is no product, why diagnose, right? There's no choice, and so that's true. That's why initiatives like this one, and we are, as a federation, we are product agnostic, let's say, as long as patients receive a safe treatment, affordable treatment, we are obviously supporting this treatment, whatever it is, because anything is better than what exists. So it's again, if I think of diagnosis, if I think of being a gap of infrastructure, comprehensive care, also the need to be centers that take care of our patients in the countries, and many of them, back to your point about equity, that's done in the capital, that's what's happening in the rural areas, still not much in many countries. So there is still a huge gap to build access of patients in those countries. Prophylaxis, as I mentioned, is also the standard treatment we'd like to push, and for that you need sustainable access to product, and you need also a policy allowing home therapy. And in many of the countries that we talk to, there's no such policy. There's no one wants to do home therapy. That's something that is not even considered. That's also a big priority for us to look at. So and I just mentioned hemophilia, but obviously there are the other inherited bleeding disorder, and we tend also to forget, because hemophilia has been fortunate. But what about von Willebrand, which is even less diagnosed, because it's complex to diagnose. There's a lot of barriers to diagnosis. So in our field, there is still, and that's a huge market for plasma product. Those patients could be diagnosed in much broader and better way than they used to be. So we are also urging the world to try to find point-of-care devices, easy to use point of care to diagnose patients closer to their community, and that's something we are working on and trying to do. So because again, this is for us an absolute priority. So this is really in a nutshell. Obviously, all the other points you made are key to us, and if we can help, and because we have 60 years of experience now, and also we have a presence in the countries. I think all the countries I'm aware of, everyone wants to help work together with the local patient association and really make this a success for all of us. So and that's great. When we heard about UNITAR the first time, we said, no, absolutely. We wish and want to be part of it and support this initiative.
Yes, and we are very grateful for the partnership and all the sharing and the support by the Federation. And thank you for bringing up also the question of diagnostics, because this is really important part of it. Me as a non-expert, actually, I'm asking, the deeper I get into the topic, I'm asking myself, to what extent should we call these rare diseases rare, in fact? Because how much is it only just about people not being diagnosed, right? And very probably the numbers are much higher, we just don't know. So thank you for bringing that to the table. Our next speaker is Mrs. Nancy DiSalvo, the International Affairs Director at GBS CIDP Foundation International. It's a foundation focusing on, and I hope I get it right now, the Guillain-Barré syndrome. Yes? Excellent. Nancy herself is a patient, and she brings a unique perspective of both, being an advocate and a beneficiary of the treatment. So Nancy, we know you have a powerful story, how the PDMPs have made a significant change in your life. Would you mind sharing?
Certainly. Thank you for having me here on behalf of the foundation and me personally as a patient. I was diagnosed with Guillain-Barré when I was 20 years old. I lived in Palermo, so that is where I was diagnosed, Palermo, Italy. And at that time, it was 1990. We did not have PDMPs available. So I was actually treated with corticosteroids, which was a huge mistake. In fact, it took me quite a while to recover. I was paralyzed because Guillain-Barré can be a deadly condition, especially if it contacts the respiratory situation. We underwent corticosteroids, so I was in the hospital for over 3 months, and it took me 6 months to start to walk again. But it was not the end because I had a relapse within 18 months. At that point, we were in 1982, I was then treated with immunoglobulins. And that was a life-changing event because thanks to immunoglobulins, I had a more speedy recovery. I started to live again because basically at that age, I was 22 years old. I had a future ahead of me, but I was on a wheelchair. And slowly with immunoglobulins, I was engaged into a different perspective of life. I came to a point in which I was actually healed and I was doing much better. But unfortunately, my life had a different picture for me because I was diagnosed with CIDP 16 years after UNITAR. CIDP is chronic inflammatory demyelinating polyneuropathy. And not all Guillain-Barré patients are diagnosed with CIDP, so I'm in one of those 5% stories. So I guess I hit the jackpot. I say that I had kind of an upgrade with my condition because thanks to CIDP, I learned the difficulties that patients actually face and the challenges on having the treatments in a more accurate and continuous way. I was fortunate to have found the foundation at that time. So I was empowered and educated by the foundation in learning about my condition, learning about the needs, and learning how to actually advocate for other patients. And that's when I was engaged as a volunteer. And I was a volunteer for 10 years, actually just being there to help patients understand the condition, help them realize how to face the difficulties, which I myself was facing. Because immunoglobulins, when I was diagnosed with CIDP, were not indicated. They were actually, it was an off-label treatment. So I found myself wandering from hospital to hospital because at a certain point, there was one hospital who actually kind of just let me go, saying that they could not treat me because it was not in their budget. So there I was, not knowing what was going to happen the next month because I was on a monthly treatment with IVIG. I was fortunate enough to find a neurologist who was not only a physician but was also a kind human being who took me into the hospital and fought his own system because they had to fight their own health system. And the Sicilian region, as you were saying, the regions in Argentina, even in Italy, each region has different legislations, different budgets, different financial conditions, even though the health system is supported by the country. So I was through on IVIG, but at a certain point, luckily, the condition was such, even though it was a rare condition, that they did have the indication. And to make it short, because this is a 34-year-old story, I have so many things I can tell you about, but these are the main focus. I was begging for treatment. I received my treatment thanks to the pharmaceutical companies who do their best and the advocacy in the world. We are now on subcutaneous treatments, which is a home treatment, and that is very helpful for the patient. For those patients who can actually do that treatment, because other patients still rely on IVIG. And in this moment, in Italy, we have a very, very high shortage, low case of immunoglobulins. In fact, the region where I am from, in Sicily, some patients who are on IVIG had to stop their treatment and are being transported to other forms of treatments, which unfortunately are not as powerful as IVIG. And that is a big problem because I was speaking to the physician, and what they do is they are keeping the what they have in the hospital for the emergencies, for Guillain-Barré syndromes or myasthenia, or those patients who are in life-threatening conditions. So they had to kind of make a choice. It seems like we are at war with the immunoglobulins. That's what they do during war. They treat those who are about to die or save what they can't save. So as a patient and as a patient advocate, it's very difficult to see that we do have a treatment, but unfortunately we cannot, we are not certain that tomorrow we will have it. I apologize.
It's okay.
There's definitely nothing to apologize. Quite the opposite. We are really honored to have this voice, and that's what we need to hear much more. And thank you very much once again for being willing to share the personal testimony. I would, for the sake of time, we need to speed up our discussion, but I would really like to finish the first round of questions, so bear with me. I'm now pleased to welcome with us Professor Dr. Guido Cavalletti, head of the Neuroimmunology Center at the University of Milano Bicocca. And Dr. Cavalletti is a renowned expert in the use of immunoglobulins, something we have been hearing now about. So Guido, can you tell us what are the main challenges you face in ensuring consistent access to immunoglobulins for your patients, and how can these challenges addressed? Thank you.
Thank you for the invitation, and I can share some of the concern Nancy was sharing with us. Italy is a country with a negative balance in terms of availability of immunoglobulins. So we have very strict rules in order to be allowed to use the drugs, the products. And this became absolutely clear during the huge shortage we had during pandemics. And that moment was really tough for us as doctors to say some patient, no, we can't go on. And that was exactly what happened, unfortunately. So I think that the only way to really tackle the problem is to improve collection of plasma derivatives. There is no other way, because we know that we have very clear indication for the use in the neurological field of immunoglobulins, Guillain-Barré syndrome, CIDP, myasthenia crisis, and these are the accepted indication, but we have a lot of other off-label potential indication for use of immunoglobulins that is very difficult to be addressed now with the availability of the product that we have. So what we need is, from our side as doctors, to be educated not to waste any single gram of immunoglobulin. That might happen in some case. Prolonged treatments for patients who probably do not need any longer to be treated, or reduce the dose if possible. That is something that it might be difficult to be done, but should be done. And work as close as possible with patient associations for two reasons. Why? The first reason is having their support once we are discussing with the government for the indication and for the possibility of using the compounds. And second, to share objectives. It's absolutely fundamental. We need to be exactly on the same line once we are asking for something, and this should be done beforehand through a close collaboration between the scientific associations and patient associations. This is my view.
Thank you very much, Guido. Coming back to our opening speakers, last two questions of this round, and we will wrap up by the first round this whole discussion. So coming back to you, Alex, I have an intriguing question for you. Some people might ask, what has UNITAR to do with plasma-derived therapies, and what has UNITAR to do with health in general? So can you help us to answer this question, and maybe can you demonstrate it on the achievements of this particular initiative?
Thank you. But before I answer, I used to have a boss, Secretary General Kofi Annan, a man that I greatly admired. He already left us. And he kept repeating one phrase, and I would like to address the question and talk about Plasma4Life from this vantage point. He kept repeating, he was from Ghana in Africa. No capacity, no development. No capacity, no development. This is a while ago, but I have taken it to heart. And as I mentioned, I do come from the development world, where it hurts, as someone said earlier today in another event. So the hard reality of the institutional capacity of the health system, particularly in the development world, and in some countries in the developed world, as you just heard, is not ideal, right? I was really struck by something that you say that is rather tricky. I agree with your word. If the patient doesn't know his rights or her rights, bad luck. This has no legitimacy at all. It shouldn't happen, but it happens.
This happens, right?
Correct. So now let me go to why UNITAR is here. No capacity, no development. We have to provide the training. Let me make it a little more technical. Please bear with me just 60 seconds. There is something called pedagogy, right? A pedagogical approach to learning, professional learning and so on. The first time that I heard pedagogy, I actually had to go to read what is pedagogy, pedagogical approach to learning. And if I can summarize a long, highly debated concept and discipline, it's how you educate, right? So capacity building has to be enshrined in a process I mentioned before that is not a one-spot thing, it's something that you build over time for patients, for associations, for governments, for everyone that is related to this thing, including the private sector. And thank you again, Giles, for being here and for empowering us to do this thing. So, what's the way to actually go about doing capacity building and having the right pedagogy? There are many, but one of them is to have a platform where we call it a repository of knowledge. And it's not a flamboyant name. It actually is. There's a lot of knowledge that goes dilapidated, spiritually. It disappears because nobody captures it. But these platforms, like Plasma4Life, and all the achievement that we have. I'm about to finish. I know that you are the time police here, so we need to make it short. But bear with me, please. There is a difference between information and knowledge. I also had to learn that when I came to UNITAR. I have been a university professor, and I didn't know that. My bad. The big difference between information and knowledge is that information, because we are bombarded by information. If we at UNITAR, with your help, manage to empower people to transform information and capture some of that, so it's knowledge that is empowering you, being it a patient, a doctor, or anyone in the healthcare system, we have done the job. How? There you have an example. The repository of knowledge and a platform that actually have training in this hub does exactly that. So I invite you to visit it. That's the commercial. Please do. Thank you. That's why UNITAR is here. Thank you.
Thank you very much. Giles, I have an intriguing question also for you, because the engagement and the sustained commitment of Takeda to initiatives such as this one is really impressive. And my simple question is, why? Why should the private sector engage? And what do you think, from your perspective, is that shared value or that shared objective between the private and the public sector in initiatives like this one?
Well, thank you, Jan. Firstly, it's been incredibly inspiring to hear from patients, Nancy, from parents of patients, Roberta, and also from representatives of patients there today. And I'm so happy that we had you with us, inspiring stories about what it means for patients to have a program like this in place. So that's why we're here. We are a company that is deeply vested in doing what's right for patients and strengthening health systems, particularly in developing countries, to enable that. And I just want to share that in these kind of initiatives, I think it's really important that we have a clear vision of where we want to go, what we want to achieve. And I think we set that out clearly under UNITAR's guidance, and this is what UNITAR does phenomenally well, is working with local health systems to define that vision for where they want to go, and then helping pull together relevant stakeholders to do education and awareness to enable them to get there. And I think we have that whole vision. We want to strengthen the plasma ecosystem in developing countries, and we want to ultimately achieve more equitable access to PDMPs around the world. And we have a group of vested stakeholders that share that vision and ambition that have come together under this platform to enable that. And I would say that's another important thing in learning for me is having the relevant stakeholders, subject matter experts come together and partner as they have done, and particularly those subject matter experts that have the right expertise and having patients around the table, patient groups, medical professionals is really good to see. Another thing I think that is very important is to ensure that those partners have a common goal and that they have the right infrastructure and support to be able to achieve that, which is critical. And then to share the knowledge and learnings from that. And this is what Plasma4Life does. It provides a platform so that other countries can ultimately learn from the experience that we're gaining in Argentina, in Malaysia, and then leverage that. And so we'd like to see this scaled. We'd like to see more countries participating. We'd like to see more members joining. We've seen even members from industry now participating as well. And I'm incredibly proud of the achievements that we've made so far, but a long way still to go. So I would encourage all those people here today. You're already doing tremendous work in participating, in supporting your countries. It's great to have a representative as well here from Italy to share a little bit your experience, but to take these learnings back to your countries and help us to continue to grow this collaboration and foster development in these countries to support and strengthen the plasma ecosystem. So once again, Mr. Mejia, thank you so much for being with us, for your leadership, for the support of UNITAR, but also to all representatives for your collaboration. Thank you. Thank you.
Thank you very much. That wraps up very nicely the whole discussion. And I know we were planning for a second round of questions, but I believe that most of the questions have been already addressed in your intervention. So I think for the sake of time, we can stop here.
And enjoy the breakfast.
Still, exactly, yes. We have still some time. Make sure that you make it, because yes, we ran a little bit over time, but we didn't want to hinder that excellent discussion. So let's make sure you stay and you remain in informal interactions. Yes, Roberta.
I want to say something that it doesn't be mentioned.
If you can
before.
switch on your mic. So
Sorry. I want to say that it's important for Malaysia and Argentina and most countries to collect data. I think data is something that we as a patient organization must think of it, and because it's a way to demonstrate where we are and where we want to be. And for example, in Argentina, we don't have any data about nothing, about blood banks, and that what we are working on now in the expert group. So I think that I want to mention that because I think that it's important to have data.
Definitely.
It's the only way to move on.
Definitely it is, because I can concur in every project which we implement. So the very important for us is to be able to measure the impact and improvement, right? Alex, then in the evaluation report, monitoring and evaluation is a very important part of every implementation of the project, and many times neglected because of and the lack of data is a big challenge. So I fully agree and support it, and very glad to tackle that issue also within the working groups discussions. That's something to be discussed, definitely. But for the time being, I would like to take a moment once again to thank all of you for coming, and I would like to thank. Yes.
I'm terribly sorry, I normally don't interrupt my colleagues, but I just want to do some justice. Bear with me 30 seconds. Dr. Micaela, all of what you see happens. I just come for the picture and the speeches, but there is a dedicated team at UNITAR. I think I cannot live without recognizing them. Micaela, thank you for a good job. And then of course, Jan, in absentia, Dr. Jeffrey was on a dedicated profession that I'm very proud to have in my team on his behalf also. Thanks for everyone's support. And now you can close.
Thank you, it's much appreciated. Yes, there's always people behind that, as you, all of you know, and that's what's the most valuable. That's also why we are here together to connect, but the people behind the dedication and the commitment is what helps us to move forward. So again, without much more words to speak, I thank you once again for coming. I thank you for engaging, for coming here to this place, because we believe that this is the only way how we can really find solutions to the problems which we tackle many times individually. We tackle with all kinds of challenges, and these can be overcome when we can speak to each other. Sometimes it takes also the willingness to step out of our comfort zone, right? Or to get out of the usual way how we do the job. But that's what it's worth it, right? Because that's how we can really move forward. So thank you once again. And before we conclude, I have one last request for you, because on the screen behind me, you see a QR code that links directly to a survey. And we kindly ask you to take a few minutes to share your thoughts, and this will help us and our team to really understand what are your needs, what are your expectations from this initiative, and helps us also to shape the future endeavors and how we will steer the whole initiative for the future so that it best fits your needs and how we can move forward together. So I invite you to the breakfast. Thank you very much once again, and enjoy the rest of the morning. Thank you.
Thank you.